Hi, I'm Dr. Chet Rehal, Chair of the Division of Cardiovascular Diseases in Rochester, Minnesota. Today, I'm joined by Dr. Rajiv Gulati from our Cardiac Catheterization Laboratory. Dr. Gulati has recently published a very interesting paper looking at the outcomes of stent patients who have nickel allergies. As we know, nickel is a constituent of the stainless steel used to make coronary stents, and this is a very commonly asked question by our patients. Rajiv, welcome. Tell us about your paper and what you found.
Thank you, Chet. Well, you're absolutely right. I think every interventional cardiologist has met with a patient who asks about the question of nickel allergy, particularly women patients who wear jewelry and cell phones, who've had rashes, and that concern has been there for a number of years, and really we haven't known how to deal with these patients. So we were faced with such a patient and decided to look back at our experience to see what had happened to patients who had stent implantation, those who had had allergies. We did a retrospective study, a keyword search, and identified 29 patients who had a history of metal allergy who then had their first stent implantation. So this, important to say at the outset, this was a history of metal allergy, patients who had claimed this rather than having necessarily been tested for it.
Rajiv, just how much nickel is there in these stents, and do they all have them, or are there some stents that have no nickel in them?
The ones that we looked at all have nickel to varying degrees, ranging from between 5 and 50% metal composition.
That's a lot.
It is a lot. If you think also, though, that these days the amount of metal in stents is decreasing with the thinner struts, so the total amount of nickel, while being a high percentage, the total amount may be less as the stent iterations have changed over the years.
Were you able to confirm any contact allergies with skin testing, for example?
Yeah, of the 29 patients all gave a history of rashes to metal exposure. 11 of them additionally had patch testing at some stage by dermatology, all of which were positive. So we did confirm it in a proportion of these people.
So what did you find?
Well, we compared their outcomes, both early and late outcomes, with a matched control group generated from our PCI database. We matched approximately 10 to 1, 250 controls, and looked to see what the outcomes were. And essentially, we found no difference. There appeared to be no harm conferred by having metal allergy in terms of early outcomes, that's death, myocardial infarction, urgent revascularization, and also over a 4-year long-term follow-up, there didn't appear to be a signal to suggest more restenosis, more death, or myocardial infarction in the allergy group compared to our controls.
And nothing to suggest an increased risk of stent thrombosis, for example.
Absolutely. So we looked at all the clinical endpoints and there appeared to be no increased risk of stent thrombosis, which would, I think, be the hypothetical concern in someone who had a local immune allergic response to stent placement.
Was the medical therapy similar, or did the cardiologist somehow more aggressively treat the patients with nickel allergy?
Yeah, that's a great question. We looked at that in detail. 2 of our patients with nickel allergy were on some sort of immune suppressant drugs for different reasons. One was on methotrexate for rheumatoid arthritis. Another one had a course of prednisone for a COPD exacerbation. But otherwise, no specific treatment was given at the time of stent implantation with a view to suppressing an immune response. We also looked at the blood work of these patients. So we checked, we looked back to see what the differential white counts were, specifically the eosinophil count and the lymphocyte count, and we found no change compared with pre- and post-stent placement in the nickel allergic
So there was
patients.
no hematologic evidence of an atopic reaction?
Absolutely. No hematologic evidence of that.
So what advice are you giving patients who come to you now with a nickel allergy and are concerned about this? What are you telling them?
I think we just have to be frank with them about the data, but we also have to be frank about the limitations of this data. This is a single-center experience. It was 29 patients only and based on their history rather than having confirmatory testing of allergy. But really there does appear to be no signal of harm. So while we can't be definitive in our advice or counseling, we can really suggest that, well, based on our experience, there doesn't appear to be any major evidence of both acute and long-term harm.
And what are you telling the patient who comes to you who has had a stent put in some years ago and now wants it removed because they're convinced their nickel allergy is causing a problem?
Well, this is the most challenging situation, isn't it? And I think we're not the only ones to have experienced this. The orthopedic surgeons have experienced this with their metal implants to joints. Those that are familiar with PFO devices have also experienced this with patients complaining of symptoms. And all we can say is, well, based on the data we have from the orthopedic literature, the PFO literature, and now the stent literature, we've seen no evidence of clear harm. We cannot exclude that occasional patient who may exist who genuinely does have an allergic reaction. I think it's important to have that caveat. And these are challenging situations.
So would you perhaps use a CTA to look for tissue edema around the stent, or is there IVUS, or are there other imaging modalities you may use?
Yeah, I think that's a great thought. We certainly could do that in patients who are going to come back to the cath lab. I think invasive evaluation would be a reasonable thing to do. I guess you can't exclude a local reaction based on a normal IVUS or OCT. CT angiogram will also be a possibility, but I guess there'll be a false negative rate that we wouldn't be aware of.
Well, Rajiv, this is a fascinating study. Congratulations on it. To summarize for our viewers, Dr. Gulati and his colleagues from the Cardiac Catheterization Laboratory have shown in a case-controlled series of 29 cases with nickel allergy who received stent implantation that out to 4 years, there was no observable increased risk of stent thrombosis, death, or myocardial infarction. In other words, indicating that stenting remains safe amongst these patients. It's important to note that almost all metals used for medical devices contain some degree of nickel within them, and that varies from metal to metal. I think these data add to our knowledge base and will help us as we counsel our patients. So Rajiv, thank you once again, and congratulations.
Thank you.